So, this has already been discussed, but really we in our clinic consider anyone that's involved in this patient's care a survivor. So that includes their spouses, their partners, any caregivers that they have. And there's really three distinct phases. The idea that there's one phase at the time from diagnosis to the end of their initial treatment. Then when they go from extending their treatment to extending their life, and then long-term survival. And we used to have reports that said only a survivor was a person who was free of cancer. Now we define anybody from the time of diagnosis all the way up to the time of death as a survivor. The reason I think that's important to say is that we will actually treat people for incontinence and ED and other problems, even men and women that have survived different cancers, even when they have a life expectancy that may be less than a year, because we feel that it's such a quality of life issue. The government has given us quite a few documents on what we're doing wrong and what we should do better in survivorship. And these are just an example of several. So we're getting more and more traction for people getting this type of knowledge. And this is a schematic of the original report back in 2005 saying survivors only included those people that were cancer-free or on chronic disease. And those were the people that we used to think deserve treatment for ED or incontinence or the rest. Now we consider everybody a potential candidate for this. And in fact, the devices I'm going to show you can be done in fairly frail men, even in their 80s and 90s. We just put an artificial sphincter that was mentioned earlier in a man who was 91 years old. So these can be done safely as outpatient procedures and really, really help with quality of life. This is a brand new slide from this year, actually, from the American Cancer Society, looking at who's surviving different malignancies. And I think most people here would be interested that, breast cancer survivors get a lot of press and a lot of funding. But look, the prostate cancer survivors are the second highest people that are surviving. And what we're really seeing is we call this a survivor bias, meaning that the cancer doctors are getting so good at treating this type of cancer that we're seeing men live longer and longer now, 20, 30, 40 years, whereas before they were only living 5 or 10 years. And this treatment's getting so good that the recent estimates are that by 2040, we're going to see 26 million Americans living in the United States that have survived some form of cancer. That's 26 million people. That's 3 times the size of New York City. So that's a very large population that we can really help out with this. I think to put things also in perspective is this is a survey from the Livestrong Foundation. It was done about 8 years ago. And what they asked patients were, what were your biggest concerns about now after treatment of therapy? And this was all cancer survivors.